Hello, Esther. The Burundian Health Ministry says it has detected its first 3 cases of Mpox. The announcement raises fears that a new deadly strain of the virus is spreading across the border into the Democratic Republic of Congo. Burundian authorities were alerted on July 22nd to 3 suspected cases in 2 hospitals, one in Bujumbura and another one on the city's outskirts. Formerly known as monkeypox, Mpox is an infectious disease caused by a virus transmitted to humans by infected animals that can also be passed from human to human through close physical contact. A new World Health Organization report reveals that road traffic death rates in the past decade are increasing significantly in Africa. Nearly 250,000 lives were lost on the continent's roads in 2021. However, global rates fell by 5% during the same period. Between 2010 and 2021, Africa recorded a 17% increase in road-related fatalities, according to the WHO status report on road safety 2023 for Africa. That's the latest update. Africa accounts for nearly 1/5 of all road deaths worldwide, despite being home to only 15% of the world's population and 3% of its vehicles. Joining us on the phone from Montreal, Canada, for more insight is Binta Sako, Technical Officer for the World Health Organization's Regional Office for Africa. Binta Sako, welcome to the program.
Thanks for having me. Hello.
Thank you for joining us via Skype, actually. Africa has less vehicles, but more accidents compared to other parts of the world. What do you make of this paradox, and what are some of the reasons?
Well, the reasons are very complex. In fact, like you said, we really bear a disproportionate burden of the road fatalities. And this has been the case for the past 10 or even more years as we're doing these reports on a regular basis. And when we look at the data, what we clearly see is that in terms of the recommendations and having a safe systems approach, the African countries are not really implementing at large scale. So we do see some improvement in some countries and some implementation of best practices here and there. But overall, I think the region is really failing in implementing systematically and sustainably the recommended actions.
Tell us about the role of infrastructure and also vehicle standards when we talk about road safety.
I think all these aspects are really very important. You mentioned too, the quality of the roads and the infrastructure and their international standards of best practice regarding the construction and the maintenance of roads. And the same goes for vehicles. The year of the vehicle. And let's not forget that Africa is really home to most of the second-hand vehicles. There's a large market for this. And most of the cars that we are entering in our region are substandard. So those are just 2 aspects of the problem. The problem is much more complex than that. And there's also, legislation around users, road users, such as wearing seat belts, drink driving. All those recommendations of best practice we've seen through the report are not fully embraced in the region.
As you say, it's a very complex problem with different steps in terms of solutions. What are the recommendations by WHO in terms of intervention that can really move the needle if we look at 1 or 2 major interventions?
Yeah, it's difficult to just find 1 or 2 interventions. I would say that really what's important is to adopt a safe systems approach. So looking at road safety in a very holistic way, looking at the users, looking at the infrastructure, the vehicle quality, and also the post-crash response is really a major difficulty that we're finding in the region, because that, fast response and, the best care possible will also reduce the number of deaths. So I would say it's really adopting a very holistic and systems approach that will make a difference. And some countries have already made good progress in reducing the number of deaths. So it shows that it is doable.
What are some of those countries?
we have about 5 countries in the region that have reduced by 30%. At the top of my head, I would say Seychelles, there's Cameroon, there's Mauritania, there's Congo, and there's Burundi. Those are the 5 that have really made good progress through political will, mainly, making it a priority in their countries and adopting a multi-sectoral and multi-stakeholder approach as well.
Okay, Binta Sako, thank you so much. We appreciate your time.
Thank you very much.
And that's our health report for today. To stay in touch, find me on X at Linord Moudou. Back to you, Esther.
Thank you so much.